It's no secret that Americans across the country are frustrated with the growing cost of health care and health insurance.
UnitedHealthcare in particular denied as many as 1/3 of its federal claims in the preceding 2 years, all while raking in record profits of $400 billion.
The C-suite executive salary compensations is a slap in the face to the average American who goes bankrupt because they cannot afford health care.
4 out of 5 major health insurance executives representing companies like UnitedHealthcare, Aetna CVS, and Elevance raised their hands in front of Congress and agreed the U.S. healthcare system is broken. But here's the twist. They don't think their insurance companies are what's breaking it. Today, we're going to break down what happened at the congressional hearing, how insurance companies are making record profits, why lawmakers are concerned about claim denials and automation, and most importantly, how massive corporations like CVS are quietly taking over almost every part of healthcare, and what that means for you as a Medicare beneficiary. Hi, I'm 𝗬𝗟 𝗕 with the Senior Savings Network, bringing you the Medicare news you need to know so you can make an informed decision about your healthcare. Last week, executives from the largest insurance companies in America testified in front of the House Ways and Means Committee, the same committee that oversees Medicare and healthcare funding. The hearing focused on healthcare affordability. Congressman Nathaniel Moran asked a direct question.
By show of hands, how many of you would agree with Leader Jeffries that we have a broken healthcare system? That's 4 of the 5 of you, and I got a little bit of a hand from Ms. Boudreau. Was that a yes or a no? Do you agree it's a broken healthcare system?
I think we have an incredible opportunity to fix our system, and I think we have to work together to do it.
But when lawmakers pushed further, the companies shifted blame away from themselves.
A CBS News analysis of about 1.3 billion federal health insurance claims across 3 years shows that in 2024, insurers denied 19% of in-network claims, about 1 in 5. UnitedHealthcare in particular denied as many as 1/3 of its federal claims in the preceding 2 years, all while raking in record profits of $400 billion.
Congresswoman Debbie Dingell from Michigan pointed out something many Americans are already feeling. Insurance companies are reporting record profits, and at the same time, families and seniors are struggling to afford their health care. She described people spending the final days of their lives battling insurance companies just to get approved for life-saving treatments.
Patients who are battling terminal illnesses are spending the last days and months of their lives with loved ones on the phones battling with their insurance company, and essential treatments are being denied. Mr. Hemsley, should sick patients who don't want to leave their families with bills have to spend hours on end fighting to get their treatments approved?
Congressman, thank you for the question. It is very important that people don't go through that kind of complexity.
Congresswoman Dingell explained that it had been shown that UnitedHealthcare denies 1/3 of their claims, but UnitedHealthcare responded by saying that they only deny about 2% of their claims.
Really only about less than 2% of all the interactions that we receive are under a prior authorization review. And the vast majority of those are administrative. And at the end of the day, 99% of all the care is covered. We should be doing more to expedite and make the prior authorization processes quick, real-time, accurate, crisp, and not interfere with care.
While Americans face rising premiums, deductibles, and co-pays, insurance executives are making more than ever. UnitedHealthcare CEO Stephen Hemsley received $1 million in his base salary, plus a $60 million stock compensation package in 2025. So where do you think he's incentivized? And Cigna's CEO David Cordani made over $23 million in 1 year. That's roughly 80 times more than a median Cigna employee makes.
We know how money gets moved around in these companies. The C-suite executive salary compensations is a slap in the face to to the average American who goes bankrupt because they cannot afford health care. You all showed up last summer at HHS and you said to Secretary Kennedy, 𝗍𝗃𝗁𝗃, yes, we've been doing things badly, we're going to fix things. I won't believe any of that until I see it, and so far, I've seen nothing.
And meanwhile, many Medicare beneficiaries are skipping medications, delaying doctor's appointments, and choosing between health care and basic necessities. One of the biggest concerns discussed at the hearing was something called vertical integration. That may sound like a complicated business term, but it directly impacts your healthcare costs, your choices, and even whether your claims get approved. To put it simply, vertical integration happens when one company owns multiple levels of the healthcare system. Instead of just being an insurance company, they also own the pharmacy, the doctor's office, clinics, prescription drug plans, pharmacy benefit managers, also called PBMs. And one of the biggest examples is CVS Health. Most people think CVS is just a pharmacy, but CVS is now one of the largest healthcare corporations in the country. Here's what CVS owns. First, CVS bought Aetna, one of the largest insurance companies in America. That means CVS now owns Aetna Medicare Advantage plans, Aetna Health Insurance plans, and the SilverScript Medicare Part D prescription drug plans. So when you enroll in certain Medicare Advantage or Part D plans, you may actually be dealing with CVS. CVS also owns Caremark, one of the largest pharmacy benefit managers in the US, and the PBMs control which drugs are covered, how much they cost, and which pharmacies you can use. Oak Street Health, primary care clinics focus heavily on Medicare patients. The minute clinics inside the CVS stores, we've all seen those. Omnicare, which is a provider for prescription drug coverage at the nursing homes and long-term care facilities. Coram, which is a home infusion and home health service, and the mental health service companies.
You guys own PBMs, you own pharmacies, you own health agencies, physician groups. Good God, you own a bank. Why would an insurance company own a bank?
Over the years, CVS also bought out multiple pharmacy chains that we all know, like Target Pharmacies, Eckerd, Navarro, and others. So now, CVS controls the insurance plan, the prescription coverage, the pharmacy filling your meds, the doctors you may be referred to, the clinics you're encouraged to use, the company deciding which treatments are approved, and that's an enormous amount of power in one corporation. Lawmakers at the hearing raised serious concerns about what happens when one company controls everything. Here are the biggest issues. Number one, less competition. So when one company owns so many parts of healthcare, smaller businesses struggle to compete. Fewer competitors usually means higher prices, fewer choices, less incentive to improve service. And those higher costs often get passed down to Medicare beneficiaries through higher copays, restricted networks, fewer covered medications. Number two, steering patients within their own system. So when CVS owns the insurance and the clinics and the pharmacy, there's a financial incentive to steer patients toward their own services. So for example, an Aetna plan may encourage you to use the CVS pharmacy as a preferred pharmacy, the Oak Street Clinic as a preferred clinic, and the minute clinics at the pharmacies, even if another doctor or pharmacy would be cheaper or better for you. That limits the freedom of choice, and something many Medicare beneficiaries don't even realize is happening. Number three, conflicts of interest in drug pricing. PBMs like Caremark decide which drugs are covered, which are considered preferred, and which require prior authorizations. And when the same company owns the PBM, the insurance plan, and the pharmacy, it creates a conflict of interest. Lawmakers worry that this can lead to higher drug prices, certain medications being favored because they make more profit, and independent pharmacies being pushed out. Number 4, claim approvals influenced by profit. If one company pays the claim and profits from those services, there's concern that financial goals may influence the care decisions. This is why lawmakers question automated claim denials and computer algorithms approving or denying care. Another big topic was something called value-based care. In theory, it means paying providers based on patient outcomes, not how many services they provide. That sounds positive, but lawmakers warned about unintended consequences. So for example, instead of staying in the hospital 5 days, patients may be pushed out after 3 days. Instead of getting 10 therapy appointments, they may only approve 6. Not because you're fully healed, but because it fits a payment model. So what does all of this mean for you if you're on Medicare? It means large corporations increasingly controlling your health care. Your plan's decisions may be influenced by profits. The choices may feel limited without you realizing why, and costs may continue rising despite record profits. This is why understanding your Medicare options is more important than ever. Not all plans operate the same way, and sometimes what looks cheaper up front can cost more in the long run, especially with restricted networks and coverage rules. Even insurance CEOs admit the system is broken, but until accountability improves, many Americans, especially seniors on Medicare, will continue to feel the pressure. If you want help understanding your Medicare choices, avoiding unnecessary costs, and making sure you're in a plan that truly fits your healthcare needs, reach out to Senior Savings Network and follow for more Medicare updates. Because healthcare should be about your care, not corporate profits. List what you think is the #1 problem with Medicare in the comments below, and please write to your congressional representative to get them to hold these huge insurance companies responsible. Thanks for watching, and stay tuned for more videos.